Hey everyone, and welcome to the channel. Welcome to our deep dive into obsessive-compulsive disorder, commonly known as OCD. It's a topic that can be misunderstood, often minimized to quirky personality traits like liking things organized, but the reality is OCD is a complex mental health disorder that significantly impacts the lives of millions. So, if you're ready to learn, let's get started. So, what exactly is OCD? It's a chronic mental health disorder characterized by obsessions and compulsions. We're talking about intrusive, unwanted thoughts, images, or urges that cause significant distress. Imagine you can't shake off the feeling that your hands are covered in germs, even though you just washed them. Or the thought of your loved ones getting hurt keeps replaying in your head. These are obsessions. Compulsions are repetitive behaviors or mental acts performed to alleviate the anxiety caused by those obsessions. You might wash your hands over and over again even if your skin is raw, or constantly check the stove, the locks, the windows just to make sure everything is safe. Obsessions fuel compulsions, and compulsions offer temporary relief, but the cycle starts all over again. It's important to remember that OCD is a real illness, not a choice. OCD can manifest in many different ways. Some common obsessions revolve around themes like contamination, harm, symmetry and order, unwanted thoughts, and religious scrupulosity. For someone struggling with contamination fears, even the thought of touching a doorknob in a public place can be terrifying. They might engage in excessive cleaning or avoid certain places or objects. Fear of accidentally harming oneself or others can lead to compulsions like repeatedly checking appliances or avoiding sharp objects. Symmetry and order obsessions often manifest in a need for things to be just so. Unwanted thoughts, often of a disturbing or taboo nature, can be incredibly distressing. These thoughts might center around aggressive impulses, sexual themes, or blasphemous ideas. The compulsions associated with them often involve mental rituals like counting or repeating phrases. Religious scrupulosity involves intrusive thoughts or doubts about one's religious beliefs or practices. Let's make this a bit more relatable. Imagine a young woman named Sarah. She's brilliant, funny, but she's also terrified of germs. Every time she touches a surface outside her apartment, she imagines microscopic bacteria crawling onto her skin. So, Sarah washes her hands a lot, like 20 to 30 times a day, scrubbing until they're red and cracked. This hand-washing ritual gives her temporary relief, but the cycle starts again with the next doorknob or handshake. Or, picture David, a loving father who can't shake off the feeling that he might accidentally hurt his children. Every time he drives them to school, his mind is flooded with horrifying images of car accidents. So David starts checking the stove, the locks, the windows, sometimes circling back home just to be sure. And then there's Emily, a college student who needs things to be perfect. Her books on the shelf have to be aligned just so, her clothes arranged by color in her closet. Any deviation from this order sends a wave of unease washing over her. These stories highlight that OCD isn't about being quirky or organized. It's about a constant struggle against intrusive thoughts and the overwhelming urge to perform compulsions for relief. Unraveling the mystery causes and risk factors of OCD. If we want to understand OCD, we need to talk about what causes it. It's usually a complex interplay of factors. Genetics definitely play a role. Studies show that OCD tends to run in families, suggesting that certain genes might increase vulnerability. But genes aren't destiny. Traumatic experiences, childhood infections, even stressful life events can increase the risk of developing OCD. Neuroimaging studies have revealed differences in brain structure and function in individuals with OCD. Specifically, areas of the brain involved in error detection, habit formation, and fear processing seem to be working on overdrive. Imbalances in serotonin levels are thought to contribute to the development and maintenance of the disorder. The more we understand, the better equipped we'll be to develop effective treatments and support those affected. Finding freedom treatment options for OCD. The good news is OCD is treatable. One of the most effective treatments is cognitive behavioral therapy, or CBT. CBT helps individuals identify and challenge those negative thought patterns and replace them with more balanced ones. Exposure and response prevention therapy, or ERP, involves gradually exposing yourself to the things that trigger your obsessions and then resisting the urge to perform compulsions. Medications like selective serotonin reuptake. Inhibitors, or SSRIs, can help regulate serotonin levels in the brain. Mindfulness-based therapies like meditation and yoga can be incredibly helpful in developing self-awareness and coping mechanisms for anxiety. And let's not underestimate the power of support. Joining a support group, connecting with others who understand the challenges of OCD, can provide a sense of community and reduce feelings of isolation. With the right help and support, individuals with OCD can learn to manage their symptoms and live fulfilling lives. Navigating life with OCD. Living with OCD can be challenging, but there are things you can do to navigate those challenges and live a full and meaningful life. First and foremost, if you're struggling, please reach out for professional help. Finding a therapist who specializes in OCD can make a world of difference. Joining a support group can be incredibly beneficial. Connecting with others who understand the ups and downs of OCD can provide a sense of belonging and hope. Education is power. The more you understand about OCD, the better equipped you'll be to manage it. And don't forget about self-care. Taking care of your physical and emotional well-being is crucial. Engage in activities that bring you joy, prioritize sleep, eat a balanced diet, and find healthy ways to manage stress. Remember, seeking help is not a sign of weakness, it's a sign of strength. OCD beyond the surface. Facts you might not know. Did you know that OCD is one of the most common mental health disorders, affecting about 1 to 2% of the population worldwide? While it's often thought of as a disorder that begins in childhood or adolescence, OCD can actually develop at any point in life. OCD often occurs alongside other mental health conditions like anxiety, depression, eating disorders, and even Tourette's syndrome. Neuroplasticity, the brain's ability to change and rewire itself, plays a key role in OCD treatment. With therapy and consistent effort, individuals with OCD can retrain their brains to respond differently to obsessions and compulsions. Remember, OCD is not a character flaw, and it's certainly not something to be ashamed of. When you're struggling with something like OCD, it can feel very isolating, so I want to spend a moment talking about some well-known individuals who have been open about their own experiences with OCD. Howard Hughes, the eccentric aviator and filmmaker, struggled with severe OCD throughout his life. David Beckham, the global soccer icon, has spoken candidly about his need for order and symmetry. Howie Mandel, the comedian and television host, has been very open about his struggles with OCD, particularly his fear of germs. These are just a few examples of individuals who have achieved great things while managing OCD. Their stories remind us that OCD doesn't have to define you. With the right support and treatment, you can pursue your passions and live a fulfilling life. OCD is a medical condition, and like any other medical condition, it deserves understanding, compassion, and effective treatment. As we wrap up our deep dive into OCD, I want to leave you with a message of hope. OCD is a complex disorder, but remember, you are not alone. Effective treatments are available, and with the right support, individuals with OCD can learn to manage their symptoms and live fulfilling lives. It's not about eradicating obsessions and compulsions altogether, but rather about changing your relationship with them. Recovery is a journey, not a destination. Celebrate the small victories, practice self-compassion, and never give up hope. There is light at the end of the tunnel, and with every step you take towards recovery, you are moving closer to a brighter future. Remember, progress, not perfection, is the goal. Well, friends, we've reached the end of our journey today, or at least this leg of it. If you found this video helpful, please give it a thumbs up and share it with your friends, family, and social networks. Let's spread awareness and understanding about OCD. And don't forget to subscribe to the channel for more content on mental health and wellness. We'll be exploring a wide range of topics, from anxiety and depression to trauma and resilience. Share your thoughts, questions, and experiences in the comments below. Let's create a supportive community where we can learn from each other and break down the stigma surrounding mental health. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content on mental health and wellness. Remember, seeking help is a sign of strength, and there are resources available to support you. Take care of yourselves, and remember, you are not alone. Until next time, DFTBA.